sit down. I'm going to stand right up.
Okay, good afternoon, ladies and gentlemen. Monday, April 16th, Committee of Health and Human Services is called to order. Please rise. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. We need a motion to adopt the agenda. We have a motion and support. We have a motion by Brown, support by Romano. Please vote. If this thing will work. Can we please do a voice vote? All in favor? Aye. All opposed? Let's not get carried away over there. Thank you. Yes, we're being technologically challenged again. Number 4, approval of minutes dated March 12, 2008. Commissioner Kleinfeld.
Thank you, Chair. I'd like to make a motion to approve the minutes March 12, 2018 with the addition of there was no vote taken under resolutions. It's an action section and there's no indication. I've already talked to Mike about it.
All right, very good. Do we have support? We have support by Sauger. Can we do another voice vote, please? Because we're still technologically challenged. All in favor?
Aye.
All opposed? The minutes are approved. Number 5, public participation. Anyone in the audience wishing to speak, you have 5 minutes. Going once, going twice, going thrice. Public participation is now officially closed. Number 6, department recommendations. A 2018 Annual Action Plan, Stephanie Burgess, Program Manager, Community Development. And the microphone is on.
Okay.
Welcome and good afternoon.
Good afternoon. Presented for your approval today is a 2018 Annual Action Plan. The Annual Action Plan details what projects and activities will be funded with the county's annual allocation of Community Development Block Grant, CDBG, Home Investment Partnership, which is HOME, and the Emergency Solutions Grant Fund. I'll refer to those as ESGs in case I use the acronyms. I wanted to give those to you ahead of time. The annual action plan was drafted before the actual allocations were announced by the U.S. Department of Housing and Urban Development. So the plan does include estimated funding based off of last year's funding for those 3 grants. We had to include in the action plan then how any differences in the allocations would be handled, and that is listed in the plan. For CDBG, any increase or decrease in funding would be absorbed by the Housing Rehabilitation Program. The ESG and home funding, that would be on a percentage basis to each one of the activities which each one of those grants.
All right, very good. Thank you very much. I need a motion and support. I have a motion by Romano, support by Lucido. Any comments or questions? This will be forwarded to the Finance Committee. Commissioner Brown.
Thank you. What was the determination of the allocation between the 3 areas? Any increase or decrease of funding be applied to housing rehab program as opposed to, what other options would there be?
For the Housing Rehabilitation Program for CDBG,
yes.
That program is really, we automatically take 25% of the allocation and put that towards the Housing Rehabilitation Program. That program also gets program income. Any funding that is reprogrammed from year to year goes into housing rehabilitation. Any increase or decrease to that activity for this year would not negatively impact homeowners. We have enough funding in that program right now to be able to handle all the applications that we have.
Thank you. Thank you, Mr. Chairman.
Any other comments or questions? This is close to $3 million in federal grant funds. Seeing and hearing no other comments or questions, we have a motion and support. Please vote. Well done.
Thank you very much.
Nice job. Thank you very much. B, my favorite, budget amendment, Macomb Community Action, Michigan Enrolls Program, the Gary Cutler, Director. Hello, Gary.
Hello, thank you. I'd like to make a correction there, though. I am not the director. I'm the Fiscal Services Supervisor.
Well, this says Director, so.
I did see that. I'll be looking for that in my check this week.
Fair enough. Before we begin with this, can I have a motion and support? We have a motion by Brown, support by Kraft. That's because you smiled. Have at it, Gary.
Okay. So, Macomb Community Action has been providing services through a program called Michigan Enrolls for over 15 years. We were notified in January that that program would be terminating effective March of this year, March 31st. So, to that effect, we notified the employee working in that position. We had a part-time field enrollment worker. They were notified. They were terminated on March 31st. And again, this is a program that we locally, with phone calls and in-person meetings with clients, enrolled them for Medicare. The state now, through online services, et cetera, have transferred it over to that and are no longer funding this program. So I did a proportionate reduction both on the revenue and the expenditures for the fee portion of that budget and brought it before you. So again, it's a program that was eliminated. It has a little further ramifications on Macomb Community Action because this is a fee for service. Most of our programs are reimbursement of expenses. Here we were giving a specific dollar amount each month, and our actual staffing cost was a little less than that. So this program helped fund our South Action Center, which is where it was housed. So in the long run, that little bit of extra money that we brought in on top of the cost of the funding was helping to run our other programs. So this loss is more than just this service, but we've also lost some support funds because of it.
So this is strictly at the Thompson Center?
That is where the person was housed.
Okay.
That's where they placed their calls out of, sent their mails, and met with in-person meetings.
All right.
Our staff has set up, we have computer terminals at both of our action centers. So if the public comes in and doesn't have an internet accessibility, we have services that they can provide there. And we also can have phone numbers to refer people for this. But it was a decision made by the funding source to terminate the relationships, not just with Macomb Community Action, but all of the action agencies around the county or around the state providing those services.
All right, very good. Any other comments or questions? We have a motion and support. We have Commissioner Leonetti.
Thank you, Mr. Chair. How much are we going to lose in that additional revenue that you're talking about when we had this position and we were able to generate services? How much do you think we're going to lose overall?
Over the years, we have had, because there's a volume that we get depending on our staffing. Currently, we had one part-time person doing that job. She was doing an excellent job getting out our numbers, but in the past, we've had two part-time people doing that job. I would say about $15,000 a year was able to be flowed into our other programs from this funding. Again, this is one of those fee for services, which is a minority of what we do,
Right.
but it is important to note that it's not just a pure reimbursement basis.
And do you know was it a decision in Lansing to cut this program? Do you know who was the source of the funding? What department?
It was a contract from the Michigan Department of Services to an outside organization called Maximus, who had
Okay.
a contract with Michigan Community Action, which had us as a subrecipient of it.
Gotcha. Okay. Thanks. Good to see you, Gary. Thank you, Mr. Chair.
You're welcome. Any other comments or questions? We have a motion and support. Please vote. This will be forwarded to Finance. Don't go anywhere. C, budget amendment. Thank you. The motion passed 13-0. Next on the agenda, budget amendment, Macomb Community Action Trauma Smart Grant. Mr. Cutler.
Okay, thank you. So this is the second year of funding that we've had in our Head Start program for Trauma Smart. Trauma Smart is a system developed by, I'm drawing a blank on the college, but it was developed to deal, because our Head Start program deals with low-income families. There's been more incidences of trauma in the lives of young children in Head Start program than the community at large. So this was a program that was designed not just for our staff, but also for the families and of the students. So we have it, this is the second year of the program that has to do with providing a trauma-aware community and counseling, et cetera, for that. So this is outside funding coming to us, and we received this last year, and we've gotten second grant this year for $100,000.
Very good. Do we have a motion and support? We have a motion by Lucido, support by Leonetti. Any comments or questions? Commissioner Toko.
Will you need additional employees to administer this program, or how is that working?
No, our current staff is doing it. It has a slight effect on because this grant doesn't pay for staffing, and because of the training with our other things, classrooms and outside training, the Head Start grant has effectively absorbed an extra week of staff time in order to provide these services because of the amount of training, et cetera here. The second phase, part of the second phase is a Train the Trainer program. So our staff will be able to continue providing this trauma smart model going into the future. But there was no money here for staffing as part of this award. So. And it was Crittenden University that provided this.
All right.
Thank you.
Any other comments or questions? We have a motion and support to approve the budget amendment and forward it to the Finance Committee. All in favor, please vote.
Do you have mine? Because mine's not saving either.
I think it's time for an impact adjustment. We need a voice vote for this. All in favor?
Aye.
All opposed? Next meeting, we all need to bring in hammers so we can do an impact adjustment on these items. Thank you. Number 7. Actually, it gives me great pleasure. Area Agency on Aging 1B. We have an update. This will be a receive and file, but it gives me great pleasure to present the new CEO that took over in October of last year, Mr. Michael Karson. Michael?
Thank you very much. It's a pleasure to be here. I'm hoping that the impact hammers don't rely on me as well. Just want to give you some brief overview, and then I'm open to questions, of course. Just want to mention the fiscal year 2017, $10,942,000, along with $55,000 from the Macomb County, went into this county to support our programs. And of that, 7,560 seniors and caregivers received information and referrals from our assistance program, while 15,000 seniors 60 or older were helped by 1 million, almost 2 million units of in-home and community-based services. Meals, home-delivered meals, 410,000. And we were able to work with 258 nursing home eligible patients that were part of our My Choice or Medicaid program that saved the Medicaid program in the state just over $10 million. population in Macomb County is obviously growing. 16 people every day turn 60 years or older. And we expect that by 2020, 222,000 residents in Macomb County will be of that age. And we are great partners, and you guys are great partners with us. It's an amazing county, and obviously a senior population that is growing. So we look forward to a good future together and supporting any way that we can the programs and initiatives from the county and now the programs that we have to bring forward. So I'd like to thank you, and I'm here for questions.
Thank you very much. Let's start with, is there a motion to receive and file?
So moved.
We have a motion by Toko, support by Drollet. I thought it was very, very important to have Mr. Karson come here and give us a bit of an update on AAA 1B. We rely on, Macomb County relies on AAA 1B, and the amount of counties and the amount of people and the amount of programs that they administer is really pretty mind-boggling. And I think it's important that we all see and have an open line of communication with Mr. Karson, who, like I said, just became the CEO of AAA 1B. Commissioner Chairman Smith.
Thank you, Chairman. Welcome to
Thank you.
Macomb County. I was writing a few things when you started, so forgive me if you gave us a little bit of this, but can you give us a little of your background?
Sure. I grew up in the nursing home business. I'll give you the whole background.
There you go.
When my youngest brother went off to school full-time, my mother got a job in a nursing home and ended up buying nursing homes and owned about 8 of them before selling out to a national company. So I grew up painting nursing homes, cutting the grass, mopping floors. I was really good at polishing them as well. So I had a good background there. I became an administrator and ran a bunch of nursing homes as the regional for the parents or the family's company before moving on. And then from there, left the business for about a year or so, but then came back and I ran a 312-bed psych building. So I did that for 10 years before going in with partnerships and owning 2 of my own assisted livings, and those were in Wayne County. And then from there, working with Brookdale, and from Brookdale, I had a territory from near the Ohio border all the way up to Midland. And then I went to Henry Ford Health System, where I worked as the director of the PACE program, which is basically a support program for people that are living in the community that need nursing home level of care. So did that for a number of years and extended the program into this county, as well as we were in Wayne County and then into Oakland as well. And then from there, I went to HAP. It was a kind of a lateral move to help start the demonstration program, which is the dual demonstration, or My Health Link, which is Medicare, Medicaid, and then of course the states are working with the healthcare providers like Aetna, Blue Cross, different companies that come together to provide services. So I did that and recruited out of there. I went to Chicago for 3 years, and in Chicago I worked for United Healthcare, and I was in charge of complex care management within the state, and I had other programs as well. I did that for 3 years, and this job was available. I was told by the person, one of the people in charge in Detroit at the Detroit AAA, and I started calling until I found a board member who would talk to me, and I drove that person crazy until I applied. Went through the interview process, moved back to Michigan, where I had a house the whole time for my adult kids who were both in school. And I'm back. I've been here now. Today is my 6-month anniversary, and I'm glad to be here. It's an amazing program. It's a dream come true for me to work for AAA. It's the first time in my career that I've been able to partner with people that used to be competitors, to bring people to the table and work together to see what we can do to benefit seniors and adults with disabilities within our community. The programs are complex. The money sources are extremely complex. We get dollars from the federal government, the state government. We have different programs and different requirements for each program. One program alone, My Choice, which is a Medicaid program that keeps people that have a nursing home level of care in their home, has over 4,000 regulations. And these programs are extremely complex. The money situation is always challenging. One program, whatever money we get in, has to pass through. Other programs have a potential to keep a little extra dollars for rainy day. But in doing so and learning about it, it's been a great opportunity to reach out to people I know in the industry and to work together with them, collaborate with them, and in doing so, seeing what we can do to help seniors. Mr. Smith and I were talking prior to the meeting, and one of the things I was saying is that there's a real gap of care for the people that have the dollars to care for themselves, whether they have Alzheimer's, dementia, or need additional services. There's a lot of places out there that will take $3,000 to $5,000, $6,000 a month to care for you. There are a few Medicaid nursing homes, but not many. And when then you look in between, what do you do with everybody else in our population that is aging that will need additional care and services? You go to a nursing home, and nursing homes are basically benefit by getting you out as fast as they can and then avoiding the hospitalization. So if you go for rehab, they'll give you rehab for 10 or 15 days for a hip or a shoulder. Then they're going to send you back in the community. Then someone's going to try to support you so you don't go back in the hospital within 30 days for the same diagnosis because there's penalties. But then what do you do after that? So we have so many seniors that are living at home, or seniors that need services, or seniors that will need some type of institutional care. They can't afford it. So there's a tremendous need, and that need will just continue to increase. Our Meals on Wheels, those requests are coming in all the time, and we have a waiting list. So we're trying to look at our dollars and what dollars we can allocate towards that to help feed people. There's real questions with people being compliant with medication, people having isolation who are living in facilities or living in homes by themselves. We have a program called NIFTY, and NIFTY is a program where we go into nursing homes and see who can be repatriated out of those nursing homes that want to go back in the community. But I've come into some areas where I'm concerned because people that are leaving the nursing homes, one in particular, an elderly female, she's wheelchair bound, she has a PEG tube, which means she has a tube into her stomach where she's fed. She's in a lower level apartment with stairs leading up. She's in that apartment by herself. Nurses will go in there 3 times a day to feed her and to put medications through her tube and pass it with a bolus amount of fluid to push it through. But at the end of the day, who's visiting her? Her socialization is zero. It's really the caregivers that are the only ones that she sees that come to see her. That's not an ideal situation, and so many people are like that. The care is needed. The need is amazingly great, and I'm hoping that while I'm here and partnering with everyone in the counties that we serve, we can try to figure out solutions to these problems.
Great, thank you.
Thank you.
Thank you very much. If you can, share which counties that AAA 1B services.
Sure, I'll start from the south because I have this really figured out really well. Monroe, Washtenaw, Livingston, Oakland, Macomb, and St. Clair. So we surround Wayne County. Wayne County used to be one large area agency on aging, and then at the time that Coleman Young was the mayor, he went to Lansing and fought very hard for Detroit to be separated. So Detroit is separated as their own service area, and then all of Wayne County is then served by Senior Alliance, which is another agency with a different name that handles Western Wayne and Southern Wayne County.
All right. Any other, this is, the population served is tremendous, and the need never ends. But that being said, any other comments or questions? Hearing and seeing none. Michael, thank you very much for coming here and for your presentation. I appreciate
the
it.
opportunity. Thank you, and I'm available anytime. I look forward to seeing and getting to know everyone better. And
Thank
good
you.
luck when you get home with that report card.
Thank you. All in, please vote.
It's just taking a second to register. So when you hit
Oh
save,
my
you gotta-
God, it actually worked. The motion passed 13 zip.
Good, how are you?
Next on, batters up. B, Martha T. Berry monthly report. Kevin Evans. Kevin, good afternoon.
Good afternoon, Mr. Chair, Commissioners.
Do we have a motion to receive and file? We have a motion by Romano,
Support.
support by Sauger. Proceed.
All right. At the last meeting that I attended, I shared this quality metric 5-star system, and Commissioner Kleinfeld asked for a little bit more information on a brief overview of how this the 5-star system actually works. So I'll be just taking you through that just real briefly. The 5-star system uses 3 different metrics. One is health inspections, which everybody's aware of. The state comes in and looks at how we do. Staffing and also the quality measures, which is the assessment process that we utilize in our facility. As far as the health inspections go, there's a point system, and it's think of it more like golf. The higher the score, the worse you do. This is what's called the scope and severity grid, and I won't go into detail on that, but you'll see that as the severity lifts and the scope lifts, you get more points against you for that. You'll see some of the points in parentheses. That's if there is a substandard quality of care, you get more points added, which is not good. So after they do all of the surveys, they put them all by state from the first to the worst. And then the top 10% or the best 10% gets a 5-star rating. The bottom 20% receives a 1-star rating. So they believe that you should have more bad facilities than good. It's just how they do that. And then the rest get put in the middle. Staffing, they look at registered nurses, and then they combine all nursing as RN, LPN, and CNA. Now they look at CNA separately, but they don't count it in your staffing rating by itself. They look at registered nurses and all nursing, and they adjust it based on resource utilization groups, or RUGS groups. About 20 years ago, they did a time study of all the different kinds of care that's provided, and they say this is the type of resources that we expect you to use for this illness. And then they apply that multiplier to your staffing levels. They apply the same value to the RN that they do to all staffing. So RN actually kind of is looked at twice inside your staffing rating. Now for us, if you take a look at this grid here, you'll see right here, this is the nursing side here on the far left-hand side, the RN side, I'm sorry. So if you are greater than 7.1, then you're a 5-star RN. If your overall staffing is better than a 4.4, then you can have a 5-star. But the only way you can get 5-star staffing as an overall is if you have both in the 5-star section. So right now we're adjusted. Our RNs are at a 0.5, which puts us at a 3-star. But our overall ranking is 5.44, which is way higher than the 5-star ranking. So we have a lot more LPNs and CNAs than most people do. Quality measures are sent quarterly to CMS, and there are 24 different quality measures, and of those, they take 13 of those out. So things like ability to move, to be independent, pressure sores, catheters, and more. So they look at those 10 long stay measures and 3 short stay measures, and that gives the quality measure a 5-star. With that in mind, they do the same thing. After they put all the quality measures in place, they take the top 10% and give them a 5-star. They take the bottom 20% and give them a 1-star, and then they portion it out in between. Okay. So that's essentially it in a nutshell. I'm pleased to say we're heading in the right direction on that. We're 2-star overall. When we started, again, we were 1-star across the board except for staffing. So we're going to continue to work to build a 5-star in 5 years. That's our goal.
Very good. Thank you very much. Any comments or questions? Commissioner Kleinfeld.
I don't know who came up with the rating system, but I find it interesting that it's sort of like done on a curve, so that there has to be losers. So if everybody did really well, there's got to be losers. And there's got to be a larger percentage of losers than there are a percentage of winners, regardless of what you guys achieve. I find that interesting that they want to make sure there's always a section of people that aren't succeeding.
Yes, as evidenced by some facilities that are medical care facilities, they actually did nothing. They were 5-star. Their quality stayed high, but because other people improved, they went to a 4-star. But they made no changes. So you're right. It is designed to really push winners and losers. Yeah. Thank you.
Thank you very much. Commissioner Toko.
Thank you. My questions were in line with Commissioner Kleinfeld's in that how can you plan for 1 star a year if your star rating is also tied to other facilities' star rating?
Well, Commissioner, hope springs eternal.
I mean, but how do you realistically plan when that's the rating system?
Well, those are goals that we shoot for so that our staff knows that we're looking for something bigger than what's happening today. We look for outstanding quality and customer service as evidenced by the 5-star. We don't necessarily look for the 5-star rating, but what we say is that is evidence of us improving. So, for example, in the healthcare, on the health inspection side, we have performed poorly over the last several years, and that stays on for 3 years. Our goal is to improve the health inspections. Our goal was to improve quality measures, and we've done that. Actually, we went from the 1-star to 4-star, which helped us move up that star. So there are areas in that cut point that you can look at and say, where can we impact? But we're focusing on the healthcare component as it relates directly to our residents. The quality measures we need to pay attention to, and we have. And that's shown an improvement in care, and it also helped us inform us as to where our care gaps were. That will then benefit us on the side of the health inspections, where we translate that into a standardized work, which we have not had consistently there, but we need to. Most of the citations that we received were isolated incidents. So we have, out of 32 residents sampled, they found one issue, and that's a citation. So we had 16 level D citations, and that was just lack of consistency. And those are all non-harm citations, but it's something that we have to work on.
What can you give us an example of what some of those citations would be? I mean, is it you don't have clean sheets on the bed, or what are they?
One, there was a resident who had a catheter bag, also is a fall risk, so they lowered their bed to help them get out, and the catheter bag touched the floor. That's a D-level citation. Another one, our policy says you have to wash your hands for 15 seconds between residents, and the staff member washed your hands for 12 seconds. That's a D-level citation. There was some drops of some milk that was on an IV pole. Some of the tube feeding product was on the IV pole, and it was just a little bit on the bottom, and it was hard to see, but it was because it's the same color, but it was there, and that's the D-level citation. So those are some of the things that we get cited for, and the standards are high because the residents deserve it, and we need to be consistent in our cleanliness and paying attention to those small details. Is that helpful?
Right. So I guess my question was: it's not the facility is not clean; it's you have these other infractions that are unique to a patient. So they're not coming in and saying you're not mopping the floors enough, you're not keeping the sheets clean enough. It's very specific to particular patients.
That's correct.
Okay.
They take a look at a sample. They do an overall look at the facility, and then they look at specific residents in specific areas. And they can find the entire place clean except for maybe there's an ice tray that had somebody who poured something in from the night before, and that's supposed to be water only, and they poured orange juice in there, and that's a citation.
Okay.
Okay, so yeah, as a matter of fact, for anecdotally, they're very impressed with the smell and the overall cleanliness of our facility. They come in and they like coming there because they said it doesn't smell bad.
Well, that's why when you mentioned that those health issues are factors that are bringing you down, every time I've ever been in there, I have always found it to be clean and pleasant smelling and appearing neat. So it was surprising when you were giving your report that you would have a low number there.
Well, thank you. It is And that's actually with CMS, their standards are very high, and they look for exceptions rather than the rule. So the exceptions become the citations.
Okay, thank you.
Thank you.
Thank you, Commissioner, and I agree with you. Every time I've been there, I've been very, very impressed with the fact that it's not like other nursing homes. Chairman Smith.
Thank you. Thanks for coming again, Kevin. Let me just ask you, I know that we meet regularly just to talk about, what's going on at Martha T. Berry and with these inspections and stuff. The inspection that you're just talking about, does that have anything to do with the recent inspection we were talking about with the inspector that was hiding behind curtains and doing things
Yes.
like that? Okay. And you can share as much as you want of it, but I like your approach on what happened with that. And we all know that at different times, I mean, I was a fire marshal and, I did inspections in buildings, and I would hear from people about different inspectors at different times, and you never get the same type of mentality with different people walking in. Some people are there to bust you no matter what, and some people are there to make sure you're on the right track and going in the right direction, and it's just a personality-based type thing in a lot of cases. So I don't know if you want to share that story, but I just like the way you resolved it at the end, and also explain that when you get one of those inspections from maybe an inspector that doesn't treat you as kindly as maybe someone else would have, even though you may have got a good response and resolution out of, discussing that with other people in the agency, it does not change your rating.
Thank you. Yes. The last few surveys that we had a particular surveyor who, I wasn't prepared for this one, but I will tell you that the vast majority of surveyors are professional, caring people that want what's best for the residents. But every once in a while, you find a surveyor that is looking to make a name for themselves, not looking for a way to help our residents and help us improve our care. And we ran into one, actually, on 3 different surveys. This person was responsible for the vast majority of the poor citations that we received. And what was considered a harm citation is, her standard is different than what most surveyors are. And we saw the pattern, and she was actually worse at this one. So we decided to actually, I made the decision to call the licensing officer and let her know of our concern. And the licensing officer came in the very next day and was very appreciative that we brought the concern and asked us to put it into writing. So we did that. We had 3 separate concerns, including the intimidation factor, where she went up to one of our nurses and said, I want to see 3 wounds and their wound care done. And she pulled her name badge out and said, and I don't want you being the one to do it. It traumatized my nurse, who's been a nurse for 15 years. She just came downstairs crying. So we had to step into that, and it's always a risk when you do that. But here's something else that's important to know. It doesn't matter if she was being truthful or not. Once it's written as a citation, it is as if it was true. Even if, and we're not allowed to, when we do a dispute resolution, we have to bring additional evidence. We can't dispute what statement she made in terms of what she quoted or misquoted. So it's, in that respect, when you have somebody that is that unbalanced, we're really put at odds on that. So the good news is that the licensing officer realized that, and the majority of the citations that were received on this last one were from this individual. And the licensing officer really does not have the ability to say, no, you're not telling the truth on that. She has to trust her surveyors when they come in. So the citations held, and then, but what she did do was send somebody in that did not have any background with Martha T. Berry. We had 7 binders, about 7 4-inch binders that had all evidence of compliance. The person came in, and and cleared all citations in one day for us. So, which is, unusual, but it was, and then the licensing officer came in on the revisit too for that, which is also unusual. And she and I spoke for almost 90 minutes about what had happened during that survey, and that she appreciated that I put it in writing, and that she sent somebody that didn't have any background with us. So we got a fair shake, and we were cleared without issue, without question. So it shows that the system can work, and that person, I don't know what's happening with that person. I just hope I don't see her again.
Thanks, Kevin. I just wanted to give you a little chance to explain that, because you kind of got into it with the unfairness in the whole scoring system, that it's basically you could have a great score, but if you're the low end of the great score, you're still going to look bad. And this is another example of how how it couldn't go against you without really being completely your fault. So I just wanted to let you get that story out, because I think it's kind of important.
Well, thank you, Mr. Chair. I appreciate that. I do want you to know that I own every citation, even if it is not, even if it's not earned, because it represents our county and it represents our residents and our staff. So I do take it very seriously. So, we will fix those things, and we have, and we'll continue to do that. We'll continue to get better. So.
And it shows. Thank you very much. I agree, Commissioner Toko. Any other comments or questions? Commissioner Sauger.
I just got one question. What's the population over there now at your?
We're up this year so far, which is good. We were down as low as 183, but we're now we hit 198 for a few days last week. We're right around 194 right now. So yeah, it's better. It's actually far better than the national average and far better than the state average still as well, even though it's still down from where we want it to be.
Right.
Yeah.
All right. Very good.
Will you take care of Kathy Toko when she comes over there? Yeah.
No, he will ensure that.
Oh my goodness.
Well, maybe we'll get you guys a suite.
Very good.
Any other comments or questions?
I would like to let you know one more thing. I believe you have it in your presentation, some pictures. I don't think you can see it on the screen, can you? Right, Mike? The presentation didn't come through? Yeah. Okay. No worries on that. But you'll see some pictures that the Rotary helped us with one of the alcoves. They donated about $7,000 to us. So the before and after of our badly needed refresh is there. And I also would like to invite all of you to a groundbreaking for our kitchen and dining renovation, May the 4th at 10:30. What's that? I'm sorry? It is Star Wars Day, yes. May the 4th be with you, yes, of course. I didn't make that up. I just want you to know. Commissioner, it's just.
I think you made it up.
No, but everyone will be receiving an email no later than tomorrow afternoon on that, and then a follow-up hard copy. So I'd love to see you there.
Very good. Looking forward to it.
All
right. We have a motion and support receive and file. All in favor, please vote. Maybe it'll work, maybe not. Well, let's do a voice vote. All in favor? Aye. All opposed? The item is received and filed. Kevin, nice job. Thank you. Gesundheit. Number 7C as in Charlie. Now we have Charlie Company. Veteran Services First Quarterly Report 2018. Laura Rios, Director. Good afternoon, Laura.
Good afternoon, everyone.
Can I get a motion and support? We have a motion by Leonetti, support by Sauger. Laura, give them hell.
All right. Okay, so we have some first quarter statistics comparing to first quarter of last year. Some key issues I want to point out. We had a no-notice inspection a few weeks ago, actually at the end of March, we had a no-notice inspection from Washington DC, and it was in response to, do you remember the student that locked down Central Michigan? That shot up his parents and locked down and they couldn't find him? It locked down a couple government buildings that were right next to Central Michigan, and it locked down a couple VA government offices. So that triggered Washington DC safety inspectors to come out and do all the outlying offices, not the federal building in Detroit, all the outlying offices where all of the VA employees sit. So that was my office, including all the other, basically counties that they would sit at, because these one or two VA employees were in a lockdown building for all of the day. And they wanted to do a risk management on, do they have metal detectors? You know, do they have like your, you know, I call it the TSA screeners downstairs, or what type of facilities? So they showed up at 8:30 on a Monday morning, and I had about a 10-minute notice that they were coming. And they basically gave me a few suggestions, and I pushed back a couple suggestions. They of course would love to have the bulletproof glass at my front window. I said, well, we had a bulletproof glass at one time that was donated to us about 8 or 9 years ago with Kermit Harris, and we were not allowed to put it in. So I said, that ain't gonna happen. And then they suggested we do have panic buttons in our office, but they're at the front office, right for the ladies up at the front. And they wanted panic buttons installed where the two VA employees are. And they wanted their desks moved around. And then they also wanted, at all federal buildings, people cannot freely walk in with guns. So, or concealed firearms or open carry. And they wanted a sign in the front of I said, like, that's gonna stop anybody. But they wanted us to have a sign. And I said, well, give us a report, write up your report, give us a report, and I'll take it to corporate counsel in our emergency management, or Ben Treppa. And so far, Ben Treppa has already installed the panic buttons. We had them installed last week. So just on a few phone calls, we got the panic buttons installed for them. But
Who answers the panic buttons?
the Clinton Township Police Department.
Oh, okay.
It goes directly to the Clinton Township Police Department. And we've pushed them. We've had pushed them before. Honestly, we have. Yeah. So, a year ago, we had a VA employee. He's probably presented here about 4 years ago. His name was Kevin Kohler. He was about 6'7", former police officer. He no longer works as a VA employee in my office. But just having him in his presence, whenever there was a scuffle up front and someone giving the little girls up front a hard time, he would just walk up there and it just calmed the presence. Because when you're 6'7" and look like a linebacker, it just handles the situation. But he's retired and fully disabled, and he no longer is. He was replaced by somebody who's about this tall, and he's also been replaced by somebody who's blind. So we have a VA employee that's very low vision and partially blind. So
That's not good.
yeah, well, she does a great job.
Oh, okay.
She does a great job at what she does, but I mean, they don't care. I mean, we're not allowed to open carry. We're not allowed to carry weapons. That's not a county policy. But you know, I mean, I try to hire men. Trust me. I do my best to hire men. It never fails. Whenever I do interviews, I have 6 men who are interviewing and 1 female. In the last interviewing process, the female got the job. So I do my best, but it's always the best person for the job. So, but we do have 2 men that are working in my office, and I do have 2 college students that are men, but they're not there all the time. So with our outreaches, they're just not there. So we are working. I am waiting for a report from Washington D.C. on what they recommend, and they even have money. Oh, you want to throw us some money? Okay, no problem. So we'll take it, but we'll see. We'll see from there. So that was a no-notice inspection based on.
Do those happen often?
Never had one since I've been here.
Okay.
They would never have came if we didn't have the VA employees. And the VA employees started in 2013, working in our office.
Okay.
We signed the MOU, Al Lorenzo signed the MOU in 2013, allowing them to share a space in our office. It really does miracles. It saves veterans. I mean, these are our voc rehabilitation counselors. That it saves veterans driving to the VA McNamara building, paying for parking, going up to the 12th floor just to see if you're eligible for any type of employment benefits or education benefits when you're not eligible for the 9/11 benefits,
Okay.
the other benefits. So having them in our, and they're so busy, they could use another one. They're that busy. But 2 spaces is a lot. Other than the statistics, we have a new employee. We're working on getting 2 more employees hopefully soon. And the other thing I have to present is my portal of service, that project that I chair for the Human Services Coordinating Body. It's not a veterans project. It's the HSCB project that I'm the chair for. And that is those kiosks that we talked about spending money to provide them free information on resources. And right now, it has been delayed a little bit because the contractor that received our equipment is still configuring it, but we should have this up and running within the next couple weeks.
Very good.
So, in our test phase.
All right. We have a motion and support. Questions? Commissioner Smith?
Hi, Laura. Thanks for, what's that?
There's a list of people.
Oh, well, it's not coming up on his.
It's,
I just have a quick question on what you just said about Al Lorenzo signing the MOU a couple years ago. What is that again? What was that for? I'm sorry,
It's just allowing them to share space in our office.
So it's an intergovernmental agreement, basically allowing,
No money exchange, just allowing them to, the VA, the federal government wanted an MOU signed. And I just verified, am I allowed to sign an MOU with the federal government? And they said, well, it'd just be best if their office signed it.
okay,
And I'm like, okay, I'm good with that.
thank you.
all right. Commissioner Kleinfeld, please accept my apologies. This thing finally works.
No, no
Commissioner
problem.
Kleinfeld?
Thank you. Okay, so your building is a federal building.
No. It's a county building.
So they can't mandate metal detector and the guards in that at that building.
No, they can't mandate it. They can suggest it, but they can't mandate it.
Well, I mean, they can suggest it, and we can tell them, I'm sorry, but our state doesn't allow that, because our state doesn't allow that. Because you're not connected to a courthouse or anything like that, correct?
And I did verify with the sheriff. I mean, I went over and I verified, I emailed them. I said, what is the state policy or the county policy with carrying weapons into county buildings? And she basically said, this was Liz?
Liz Darter.
Yes. And she said that it's the same state policy, that if they have a concealed carry license, they can carry it. I mean, this isn't a court building, it's not.
No,
your building.
this building is, because of the direct connection to the court through the tunnel, is the reason that you can't hear, because you could just turn around and then walk into court. And I believe over where the elections is because of their, the probationary department they have over there as well. But
But my
generally
building is not.
speaking,
But
yeah.
my building is not.
Yeah, so, so when they, I mean, I just find that interesting, because apparently they didn't know or understand the state laws
Correct, they did.
don't.
not.
The Michigan Veteran Affairs audit, I have a question with respect to finding number 2. It says MVAA could improve contract monitoring by obtaining annual audit reports. Do you know if they were not having annual audit reports? And this seems to be an audit report, so I was wondering if you knew about that. You
I just provided it.
you just provided it.
I just provided their findings because I got a copy of it.
Okay, thank you.
Next, Commissioner Drollet.
Thank you, Mr. Chair, and thanks for your report. Appreciate it. Just wanted to follow up on Commissioner Kleinfeld's audit question. The second part of that finding says that Veteran Service Organization officers did not work their scheduled days 23% of the time, or at their approved locations 8% of the time. Can you put that in context? What does that mean? Does that mean they missed 23% of the days they're supposed to be working, or what does it mean?
So MVAA, which is the State Michigan Veterans Affairs Agency, covers the cost of American Legion, VFW. There's like 6 organizations that they pay for and provide funding for in the McNamara building in Detroit.
Okay.
Okay, that are service officers. They do the same job I do, but my funding comes from our millage. So they don't provide any funding to our office. So I am not part of this report from MVAA, okay? So my office is not part of that MVAA audit.
Oh.
Okay,
I see.
so
So this audit is not an audit of your office
No.
specifically, or your department?
No.
Okay.
This audit is from the state Michigan Veterans Affairs Agency, who also oversees those 6 offices in funds, partially funds, not all funds, but they do fund a portion of all 6 of those agencies. And they also have their own veterans service officers that do the same job I do up at the state level.
Okay.
Okay, so they do have those. Now, because they provide that funding, they're tracking their hours, they're tracking how they do their job down in Detroit.
Gotcha. So 23% absenteeism in Detroit is actually pretty good. It would just be bad here. But so anyway, okay, thank you. You clarified that for me. I thought
So
this was
that's the
specific.
That's the VFW, American Legion, Purple Heart, DAV, I believe Marine Corps League, and VVA, Vietnam Veterans of America. So I want to believe, and they could list them in that report, but I want to believe that, 4 or 5 years ago when they took them off, they initially funded like 12 different organizations, and then they took them all off their funding list and made them apply for funding, and then they funded only 6. So for like the last 6 or 7 years, they were only funding 6.
So
So that's who are included in that report.
just a quick follow. Does that hurt our service providing when a quarter of the time apparently these folks are not on their scheduled days and showing up?
No.
Okay. Okay. Thank you very much, and thank you, Mr. Chair.
Thank you. Next on the agenda, Commissioner Sauger.
Yeah, Laura, earlier in your comments, you mentioned something about a panic button,
Yes,
and that is installed there now?
yes.
And
We've
who-
had those.
Okay, now who ordered or who picked Clinton Township to respond? Why I say that, you're right around the corner from a bunch of sheriff's cars coming
Correct.
in and out, back and forth, but your
Right.
panic button goes over to Clinton Township. I mean, the sheriff's department will get it eventually.
No, because we're in Clinton Township,
I know you're in Clinton Township.
and that's why they have to respond. They have to respond because we're in Clinton Township. That's,
I'll argue that one till whenever, but
that's,
anyway, in
that's
the
the way that
comment,
one
yeah.
works.
Let's make it easy, and you should get your concealed carry license.
Oh, there's a few. There's not too many veterans that don't have a concealed
Yes.
carries license.
That-
If you think about that, there's not too many veterans that don't. So,
Fair enough. Any other comments or questions? We have a motion and support to receive and file. All in favor?
Aye.
All opposed? Laura, well done.
thank you all.
Thank you
for
very
your
much.
support. I really appreciate it.
8A, we have correspondence. 8A from the Michigan Veteran Affairs Agency Performance Audit. If
Just
Commissioner,
in their entirety?
yes, we have a motion to move them all in their entirety by Commissioner Kleinfeld, support by Commissioner Kraft. All in favor?
Aye.
All opposed? We're doing voice vote till the end of this. Apparently, the Wi-Fi is a mess. Oh, okay, gone. Number 9, resolution. Resolution to amend R17-500, resolution establishing Older Adults Advisory Committee offered by Chairman Smith. Commissioner, you want to explain this?
Sure. We just looked at this. I had Scott look at the resolution, and Patty went over it. We all went over it again and just started looking at some little tweaks that needed to be made. One of them was the numbers were wrong in the expiration date for the at-large members. We had to change that. We decided that the recording secretary should be one of our staff members. The meetings are going to be held here. We're going to use this system. And see how difficult it is, even with someone that knows what's going on here, to get this to work. So we figure we won't entrust or charge the new members with learning this quite, at least off the bat. A lot of these changes may be, just until everybody gets acclimated with things. We put in there Robert's rules instead of the board rules. And we, obviously we're working on the board rules, still changing those, but, another document that's kind of in constant flux as we realize different things that work and don't work. But we figured obviously they should follow the same rules that we're following. And then as far as the staffing, we looked at it and read it a little better. And as far as the chair and vice chair, it's going to be one of the members of our board, me at this point, especially at the get-go, because they don't know what's going on or what's expected of them until we get moving on it. So they're kind of housekeeping cleanups right now. Any other questions or any questions on them? I'll try to answer.
We need a motion to,
I'm on the list.
Everything's
I
moving
tried
slow.
getting the list and
Are there costs associated with our people, our staff doing that?
Everything is, they'll be here at these times anyway, and I'm sure that for the most part, they'd be sitting in on these meetings. Right now, there's no plan on adding extra staff for any of this type of stuff. And right now, they're gonna be meeting once a month, maybe less at this point, so
So it'll be during the day?
it'll be
when our
during the
staff
day,
is normally
correct?
here?
Yes.
Okay. Thank you.
any other comments or questions? We need a motion to recommend this to full board. We have a motion by Drollet, support by Kraft. Any other comments, questions? Seeing and hearing none, all in favor?
Aye.
All opposed? The motion passes. Number 10, new business. Any new business from commissioners? Any new business from staff?
I have something.
Commissioner Chairman Smith.
Just wanted to point out that next Wednesday is going to be a long day, long night. Just plan accordingly. We're going to have finance and the volunteer meeting, and then I'm sure most of you got and read that we'll probably be seeing the retirees that are involved in the lawsuit that night. For some reason, in the last 2 years, it's come up on volunteer night where they've been requested and encouraged to come, and it's just been pure timing of the court cases. So, but just so you know, it's going to be a long evening that night.
As opposed to today. Any other new business? Number 11, public participation. Anybody in the audience wishing to speak, going once, twice, thrice? Gotta ask. We have a motion to adjourn by Drollet. Leonetti. All in favor? Aye. All opposed? Thank you, commissioners.